symptoms of his lungs, I might start it. Wait, what? Then the doctor came around and said, Abby, your life is gonna really have to change. Trust me, remember when we tested you that day? Wasn't about positive drug use, but sent him to. They gave me all my meds last night, and this time, they told me you should never, ever, ever miss your medication so we can keep your CD4 count under control. Take your heart medication, stop the same time as prescribed. So I should never, ever, ever miss a medication, like ever. No, was really right when she told me that I needed to be safe, and I started having unprotected sex with some guys that were just looking for a really good time. So, I know I think about that night, and that night, I can't remember something now. I would have been back forever, taking my medicine, but I don't like the rest forever. Before all the sessions, you infected my friend, infected your friend, infected me. So we are never, ever, ever gonna have sex together. I used to think I wouldn't get HIV ever, ever, and I used to say, never say never. So he called me again and he was like, legit. And I was like, I'm just thinking my life will never, ever be the same, like, ever. So, I never, ever, ever use medications on you. Should never, ever, ever use the medications. You infected my friend, infected your friend, infected me. So you should never, ever, ever use your medications. Take my medications at the same time as prescribed. So you should never, ever, ever miss your medication.
Hello and welcome to the Dr. Steven Show. Today we're going to be discussing human immunodeficiency virus with our very special guests.
Woo! Bring them out, bring them out, bring them out, bring them out. It's hard to yell when the barrel's in your mouth. Bring them out, bring them out, hey. Bring them out, bring them out, bring them out, bring them out, hey. Bring them out, bring them out.
HIV begins when an individual is exposed to infected fluids. Once inside the body, HIV attracts CD4 cells. HIV then infects these CD4 cells with the viral code, producing multiple HIV cells, and then continues to replicate within the body. With disease progression, CD4 cell counts fall. Once below 500, the patient is diagnosed with human immunodeficiency virus. And now on to a star from our music video, Isel.
Alright, so I just want to clarify about the risk factors for contracting HIV. The most common one and the most dangerous one is having unprotected sex, and the risk increases if you're having unprotected sex with multiple partners. The second one is the sharing of needles, mostly with drug use. The most dangerous one is the hollow bore needles because blood actually gets trapped in there. The third one is from mother to child during birth because the newborn or infant is actually exposed to the mother's infected blood. Last but not least is the healthcare workers through needle sticks, but we also need to know that the risk is very low. Some misconceptions: HIV cannot be transmitted through hugging, kissing, holding hands, urine, sweat, tears, and feces. Also another very important one is that HIV is just not a homosexual disease. Anybody can get contracted. It is not who you are, it is what you do that makes you susceptible to contracting HIV. Not about that.
Yes, like Isaiah was saying, it can be a very frightening time for an individual when they have found out that they have been diagnosed with HIV. It is very important to let them know that there is hope beyond their diagnosis. Depending on their CD4 count, their viral load, and their willingness to begin treatment, doctors may prescribe a regimen known as HART that consists of retroviral medications that decrease the viral load in the bloodstream. These medications should be taken every day at the same time exactly as prescribed to reduce the risk of contracting AIDS from mutations in the HIV gene. The goal is to decrease the viral load and increase CD4 cells. However, since there is actually no cure for HIV, the best way to avoid contracting it is by prevention. So here's where Nancy comes in. She's going to talk more about the prevention methods.
Thank you, Blanca. Like she was saying, there is no cure for HIV, but there are preventative precautions that one can take. Take, for example, the video that we just watched. It had all the scenarios were based on things you should not do, so don't do that. Stay away from that. Like, take, for instance, the scenario where they were going to go have unprotected sex. You don't want that. You want to go ahead and use the condoms. That's what they're for, to prevent HIV. Another one would be the use of using drugs. If you're going to be sharing needles, go ahead and make sure that if you're not going to be switching to new needles like this, always keep them in a new packet. Make sure they're not open instead of just sharing needles, used needles. If you're going to be using used needles, go ahead and flush them with bleach so you can disinfect them. Another one would be from mother and daughter, like Isaiah was saying. Pregnant women do have a choice of having C-sections just in case, because it reduces the ability for the infant to contract the disease and the only way that this procedure is taken is only if it's beneficial to the baby and if the mother is highly infected with HIV in the blood. All in all, it is just one preventative. It's just not sharing toothbrushes, needles, blazers, anything that will transmit any body fluid secretions. And with this, they're going to be, Cecilia's going to be teaching about education and teaching.
Thanks, Nancy. Okay, some things I want to say for patient teaching. One thing is for the patient to eat a balanced diet. It is important for them to eat proteins, fruits, vegetables, and multivitamins just to help with their immune system. And it's also recommended for them to exercise at least 30 minutes each day, 3 times a week. And that's just for immune system because they are suppressed. It is also important for them to set up goals before they see the healthcare provider, just to be more informed and be proactive in their learning. Also, they should take the flu vaccine each year and avoid large crowds when winter season comes. They should also wear a mask just to decrease infection as they are immunocompromised. And Camila, would you like to add anything else?
Yeah. So I just wanted to talk about how we need to make sure that we include the older adults in these teachings because they are a really high-risk population. Usually we, as healthcare providers or like any healthcare provider, don't really ask the older adults if they're having tested for like HIV. But we need to make sure that we do ask them because even though there's a misconception that they do not have, sexual relationships, they do, just like anybody else, and we need to make sure that we include them in the teaching. And also, if you have been diagnosed with HIV, I just wanted to let you know that there are like support groups out there that can help you with that. Also, there's a website, it's called avert.org, and I just wanted you guys to just go ahead and check it out. It has a lot of information about like things, what to do next and what to expect when you get HIV. And just make sure that you take your medications as prescribed and never ever ever miss your medications. And that's it. So here you go, Steven.
Okay, thank you ladies for sharing that information with us, and to end the show on a good note, let's listen to our favorite song.
I'm gonna die, just like I had the symptoms of this life.
welcome to this Dr. Steve.
It's a very frightening time for an individual when they have discovered that they have been diagnosed with HIV. It is very important to let them know that there is hope beyond their diagnosis. Depending on their CD4 count, their viral load. You guys lost!
Hey, bring 'em out, CNIP, coming live from the VIP.